Global health security is about taking action to minimize the risks and the impacts of infectious disease threats and other health risks that really pose a threat to humanity. And every country in the world, no matter if they're rich or poor, needs to have some essential capabilities to be able to respond to these risks and to the potential of an emerging infectious disease that could, if not contained, could spread out of control and become a very deadly and costly epidemic, or worse yet, a pandemic. The state of global health security today is really mixed. It was in mid-2014 that all of us around the world, across our television screens, saw horrific scenes of people dying in the streets in West Africa from the deadly Ebola crisis. And unfortunately, because that was left unchecked for quite a while, more than 11,000 people died and more than 27,000 people were infected, and it really devastated the three countries in West Africa at the epicenter of that outbreak. And the world really had an awakening that we need to do better. And so there were reports and commissions and panels and lots of media attention saying, what does the world need to do to be better prepared and avoid this from happening again? And there were over 200, 300 recommendations that were issued from all of these commissions and reports. And the good news is that a number of those have been acted upon. So we see today that the World Health Organization has better capabilities to be able to respond to outbreaks around the world. The reality is that outbreaks are increasing around the world due to climate change, due to population growth, due to migration. So we're seeing more outbreaks, not less. And most experts agree that the likelihood is that it's not if we're going to have another pandemic, it's when. I would say the biggest challenge that the world faces when it comes to global health security is what we call the cycle of panic and neglect. So a crisis happens, there's panic, resources flow, lots of attention. The outbreak, the health risk goes away and the attention dies away, the resources die away, and it's no longer urgent. But yet countries haven't dealt with the underlying issues to be better prepared. We are seeing, and we will continue to see, that the biggest threat of infectious disease outbreaks are going to be in the poorest and most fragile and often conflict-ridden areas in the world. So think of Syria with the measles outbreak, think of Yemen with a cholera outbreak. And right now in the Democratic Republic of Congo, we have another Ebola outbreak, and it's taking place in a part of that country which has been very conflict prone. So this is going to continue to happen, and we need to support those countries. It's in the best interests of the world to do so. Some of the reasons I'm optimistic are that more than 90 countries undertaken these joint external evaluations. So they've let others come into their countries and say, all right, we know we have some problems, tell us what they are, and then many of those now are working on their national action plans. I'm optimistic because there's something called the Global Health Security Agenda, which countries all around the world are coming together and they're sharing solutions, they're sharing lessons learned, they're holding each other accountable. So they're coming together to forge and solutions and make the world more secure.